Today we're going to be talking about simultagnosia or simultagnosia. And basically it's nausea, which is no, but we are agnosia, don't know, and simultaneous, which is two stimuli presented at the same time. So when you have simultagnosia or simultagagnosia, you don't know simultaneous stimuli. And so patients with that complaint often say they can see the individual pieces of a visual image, but they can't put it together. So they can see the trees, but they can't see the forest. And so one of the standardized ways we test this is with this standardized cookie theft picture. And so a patient who has simultagnosia or simultagnosia will see the girl and the boy in the chair, but they won't be able to put together the picture. They'll see the water is running down. So we ask them, what's going on with this picture? And they will be able to individually identify each of the pieces, but they won't be able to make a cohesive story out of it. So this is a standardized simultagnosia test. And one of the interesting things is we use the Ishihara color plates, which is usually used to test for color vision deficit. But just like the cookie theft picture, in a patient who has simultagnosia, they can see the individual dots, but they can't see that the dots actually make up a number, even though they can see the colors. So they might get 0 out of 14 on the color plates, even though they have 20/20 acuity in a normal exam. So we can use the Ishihara color plates as a test for simultagnosia. And that is a very fascinating way to use that color plate. The way this comes to us is patients have seen multiple eye doctors, they have normal vision, they have a normal eye exam, pupil, everything is normal, but they're still having this persistent complaint that they can see, but they can't process the information. And so a patient with this condition might be able to identify each of these geometric figures individually. So if we were to separate them out, they would be able to tell what they are. But once we start stacking them up on top of each other, they won't be able to interpret the image. They will get confused. And so this is a visual processing problem. The processing problem can occur in the visual association cortex, like adjacent parietal lobe. They may or may not have a homonymous hemianopsia or neglect. And if you have bilateral lesions, it might be associated with optic ataxia. And what that means is they mislocalize in space, or oculomotor apraxia, where they can't move their eyes with supranuclear gaze towards objects, and simultagnosia. That constellation of findings is called the Balint syndrome. So you should know that if you have simultaneous agnosia, cookie theft picture, Ishihara color plate, the complaints are quite vague, but they have normal eye exams, and they can see the individual pieces, but they can't see the forest for the trees.